Alright, so the first thing we want to do is kind of look back here inside the cranial fossa, and we can see the trigeminal nerve here in green, feeding into the trigeminal ganglion. And then we can see those three different branches here, okay? We can see that ophthalmic, our maxillary, and then the mandibular branch of the trigeminal nerve. Remember we said those are also V1, 2, and 3. So the ophthalmic branch is going to actually pass through the optic canal, through the superior oblique fissure, or superior orbital fissure, excuse me. It's going to come out like this, and then it's going to come out over the eye and give us a couple of nerves just like this. Okay. So let's take a look at that on the other side. If we look here above the eye, we can see two things. Okay. We can see one of these nerves that's a little bit more medial through here. That is our supratrochlear nerve. The one that we see coming out right above the eye is coming through that spot we call the supraorbital notch or the supraorbital foramen. Remember, it could be either one. But on this cadaver, it's a notch. And if we look right through there, we can see the supraorbital nerve right over the top. So it's directly above the eye. Now the nice thing here is that the arteries carry the same name. So the trochlear nerve, the supratrochlear nerve, has the trochlear artery that travels with it. Okay? And then same thing for supraorbital nerve, it has the supraorbital artery. So if we have a supraorbital, we're also going to have a infraorbital. Now if you see here, we have the maxillary bone highlighted. It's not part of the zygomatic bone, it's something separate, right? So the opening through there is the infraorbital foramen. And coming out of there, we have the infraorbital nerve. If we turn this just a little bit to the side, we can see the zygomatic bone, right? Now the zygomatic bone has a foramen right on the middle of it. And coming out of there is the zygomaticofacial nerve. Okay, so zygomaticofacial nerve. Now, back in osteology, we saw another foramen, but maybe you didn't, okay, called the zygomaticotemporal foramen. It was hard to see because it's actually behind the frontal process of the zygomatic bone. So if we move this back to the posterior aspect through here, we kind of turn it around. We can see it emerging back here. This is the zygomaticotemporal nerve.
Where's he coming from, Dr. Lunsford?
So that guy's coming through a foramen called the zygomaticotemporal foramen. And it may have been on your list like way back when in osteology, but it's one of those foramen where like we typically couldn't show it to you just because of the location. There normally wouldn't be there. Now, if we keep looking down the face, we're going to see another nerve right here where the mental protuberance would be. And this is called the mental nerve. And we're going to see where that comes from in just a second. So remember, we have our mandibular branch of the trigeminal nerve, right? And the mandibular branch of the trigeminal nerve is going to split into two different nerves. One of those are actually going to go inside of your mandible. Okay, if you remember that mandibular foramen was on the posterior aspect of the mandible. There's an opening through there. That's the inferior alveolar nerve. So here we can see the inferior alveolar nerve. And we can see that it's actually passing through the mandible itself and kind of ghosted there. As it's passing through here, it's actually going to begin to give us little branches that are going to go to the teeth. Okay, so these little branches come off. And the continuation of that inferior alveolar nerve is also going to give us that mental nerve. So the big difference is that that inferior alveolar nerve is gonna travel inside of the actual mandible itself. The nerve that's right beside it though is the lingual nerve, which is gonna go towards the tongue. And we said previously a nice and easy way to see that was to find that submandibular ganglion. Okay, right there. So you see that bulge right through there? So our submandibular ganglion is the big bulge.
So you said this was the
Yes. So we put that. So here again, you can see where that inferior alveolar nerve is connecting directly into our mental nerve, right through there. Put that jaw back on. So again, those are gonna be deep, but they're gonna go straight through there. There you got it. I believe that's all the branches that were under those general nerves. Is there anything, the greater and lesser palatine nerves? So you remember we saw the pterygopalatine ganglion last week, or maybe 2 weeks ago at this point now. You remember we saw those two nerves, they pierced the palate. One moved anterior towards the incisors. That was the greater palatine nerve. The other one goes back towards the back of your throat. That's the lesser palatine nerve. I kept telling you, it's not on your list now, but it will be. And I pointed it out every time we saw it. That's what we're talking about, that greater and lesser palatine nerves. That's all it is. We'll see it clearly from the models. I don't know how clearly we can actually see it on the table, but we'll see it clearly from the models just like we did before. Now the last nerves we want to see are pretty easy, okay? They are branches from the facial nerve. I think maybe I left it there. Yes, okay. So the branches from the facial nerve go temporal, zygomatic, buccal, motor, and then cervical branch. They're exactly where they sound like they should be. The temporal branch is gonna be right here. And remember, it's temporal branch of the facial nerve. It's going up towards the temporalis muscle. We're then gonna see the zygomatic branch of the facial nerve. We then see the buccal branch of the facial nerve. The mandibular branch is going to be right along the mandible itself. And then the cervical branch is going to be the one that we kind of lose off the mandible. Remember we said that that was going to be innervating the platysma. So we use this little mnemonic here to help us remember those. I don't know why it works, but 2 Zanzibar bimotor car. I was lazy, I didn't write the bar part. 2 Zanzibar bimotor car. Bimotor car, yeah, I don't know why, for some reason. I heard it one time and it was just there and it never left. I don't know why though. So if that works for you, great. If it doesn't work for you, figure something else out. Everybody okay with those?
Quick question.
Yeah, what's up?
Is the supraorbital a branch from supratrochlear? It just looked like it was
So
part of it.
the ophthalmic branch of the trigeminal nerve pierces through the orbit.